Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Well, hi there, Dr. Darrow.
Hello, Nita Valens. How are you today?
Excellent. And yourself?
Excelente. And I'm living it up, too.
Well, that's pretty awesome. We want our listeners to live it up, and if they call the program right now, they will get your latest book for free. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has 264 scientific studies, and the foreword was written by Suzanne Summers, and our number is 866-870-5752, right here at the station, 866-870-5752. You want more? I got more. I got a website.
Do it.
People can find you at www.lastemcells.com. That's lastemcells.com. You can see videos of Dr. Darrow performing the treatments and email him off of every page on the site.
I love that. I love my website, too, because it's something I work on every day, cleaning it up more and more, putting out more information, and you can learn all about it, and you can email me through there. I hope you call me now rather than email me, because the direct communication will give you more information. But is it okay for me to take some questions here, Anita?
Oh, absolutely. Yeah. Why don't you just give the phone number one more time? 866.
Let me do it. Let me throw my voice in there.
What a gentleman. Go for it. Chivalry is not dead, folks. Go ahead.
No. So you want to reach me right now, you can talk to me live at 866-870-5752. That's at the studio. I would love to talk to you. Anything about your musculoskeletal issues, orthopedics, about stem cells, about PRP, platelet-rich plasma, about how to heal without getting surgery. That's really what's going on here. And I have so many patients come in ready for a surgery that they never needed to begin with. And sometimes I have to talk them out of it, or at least give them a chance to heal without getting the surgery. You can always get a surgery. You know, whatever I do is not going to block you from getting a surgery, but it can help you from getting a surgery. And that's really the name of the game when you're in pain, is to please don't rush to get a surgery unless it's an emergency. Then of course, you know, that's a great idea. If you have a broken bone, something like that, you've been really traumatized in some way, yes. But most of the stuff I see, most of the patients that come in don't need surgery, and we get quite a few of them healed up. What I do does not heal everybody for many different reasons. Sometimes people are too active and they cheat on me. I know that seems funny, but they tell me they're not going to exercise after I do the injections. And they do, and then they go, I didn't get better, and I say, yeah, but you didn't give it a chance to heal. A lot of times people are injected without an ultrasound, which we use to look inside the body. If you're going to try to get into the knee joint or the hip joint or the shoulder joint, it is almost impossible to do that without the doctor using an ultrasound to look inside and see where that needle is going. Another failure reason is people sometimes come in, they'll get one treatment, come back in a couple weeks and go, it didn't work. But that isn't the case. It is working. There is tissue growing back. There are studies on that show that when ligaments are injected, for example, they get about 50% thicker and about 200% stronger. So that's a lot to do with like necks and backs. A lot of people come in ready for a neck or back surgery, which fail a lot of the time. There is a diagnosis, failed back surgery. that means that you had the surgery and it didn't work out too well. And if an insurance company has that diagnosis, then you know it's happening very frequently. So be careful. So let's see what this one says. Meniscus tear in both knees. I have meniscus tears in both knees. I've been told that due to arthritis, the support structures on the knee are not there, and I'm a great surgical candidate. Now, what does that mean, a great surgical candidate? That's ridiculous. I'm 74, healthy, avid tennis player. Can you help? Well, hopefully. I have to examine you first and touch the area and move it around and see what's going on. Unfortunately, as you hear me say on every show every week, way too many surgeries are done without even touching the patient to find out what is going on. This is more information. So I did email back this person, and then they fired back an email to me. It says, my knees do not hurt when walking correctly with arch supports. Well, that's good. Stairs hurt my knees. Inclines are okay if I use good body mechanics. That seems to be somebody who could really use stem cells or platelets to heal, because you don't want to live your life having to use good body mechanics or walking correctly. You want to just fix it. They don't lock up. That's good. I'm status post laminectomy, L345 at Stanford. I plan to start gently playing tennis soon. Surfer from Morro Bay referred you to me. Yeah, I know who that is. I get a lot of surfers from up in that area around Mavericks and Santa Cruz and Morro Bay. Those guys are tough guys to go out in those giant waves. My son Benji surfs at Mavericks. He lives at El Granada right there. And I've seen him on waves 60 feet high.
Oh, my goodness.
Yeah, it's crazy.
Wow.
Hope you had a good holiday. Thank you. There's a lot probably I can do to help this person. No promises ever in medicine. That'd be silly for a doctor to promise anything, because everybody is different, and all we can do is use the procedures that we have used before that have helped people, and hope that they work for you. So my experience with my own body, as all you guys know who listen to my show, I've used these treatments for the last 23 or 4 years now on my body. I get a lot of injuries because I am very repetitive in sports. I'm kind of a perfectionist. And it's very noisy on your end there. And so I do get pain in my body, and I typically don't treat it until I can't use that joint or whatever it is anymore, and then I treat it. I haven't had to inject myself for a while, thank goodness. My wrist was the first body part, and I injected that first back when I was actually in residency at UCLA. And I haven't had to inject that in years and years and years. I can't remember the last time I did that. But it's pretty interesting. When I inject myself, it doesn't bother me. People say, how can you possibly inject yourself? Well, I trust myself, so I don't have any fear about doing it. I would have fear if another doctor did it, because most doctors don't really have the experience how to do this. A lot of doctors do this, but they don't do very much of it. If you're going to get regenerative medicine done, with stem cells or platelets, please check out the doc and ask, how many have you done today? How many did you do yesterday? How many last month? I do them all day, every day, and I'm very confident in what I do, and I do still tell people I can't promise they're going to heal, because healing is something that is, in a sense, spiritual. It is scientific in a way, but it's also something that some people heal real quick, and some people take a long time with several injections to get healed. So in addition, if you don't call me now at the studio at 866-870-5752, you can call at my office. And there are people by the phones right now at 800-300-9300 if you want to call about something you don't hear about on the show, you can call there then, anytime you want. You can call now or call later to the office at 800-300-9300. Please don't forget, looking at the website, there's tons of videos of me doing the procedures, and you can email me from any page there, and that is www.lastemcells.com, www.lastemcells.com. Anything for you to say, Nita? Yeah, you are going to prompt me to talk about something, so I will, without you saying it.
Okay.
We also do cosmetics, you might say. Aesthetics is another term, in the face and the top of the head. So we use these same procedures to grow hair on the head and to also regrow the collagen in the face. And one of those treatments is called the vampire facelift. And the reason it's called the vampire facelift is because we inject your platelets from your blood or your stem cells from your bone marrow into the face and regrow the tissue there and make you look younger, bring you back to life in a sense before the tissue started drying out. We're all drying out as we get older. I used to be 6'1" when I was about 16, 17 years old. I'm probably down to about 5'11" now. The discs in the spine dry up. That's called degenerative disc disease. It doesn't cause pain in and of itself. A lot of people come and they go, I have DDD, or degenerative disc disease, or DJD, and that doesn't necessarily cause pain. So don't think because a doctor tells you you have something like that, that is a pain generator. Scoliosis is another one. Unless scoliosis is very advanced, where you're leaning over and you have trouble breathing, it doesn't necessarily cause pain. So we have to find what the pain generator is. I just had a gentleman come in on Friday, and or was a Thursday, I'm sorry, and he was ready for hip replacement. He had a labral tear. I saw that under the ultrasound, and then I looked at the other side. He's got the same stuff on the other side, but no pain. Then we're talking, and talking is a good thing with the doctor because we find out when we talk in depth things that we didn't even think about. So I'm all focused on the hip joint because we see the x-rays, this guy's all ready for hip replacement, blah, blah, blah. And then he says something about his adductor tendon. The adductor is the muscle in the middle of your thigh that attaches up at the pubic bone, goes all the way up there. And a lot of people have adductor tendinitis, or what we call a sports hernia or pubisitis, and it has nothing to do with the hip joint. It's close to the hip joint, but it's nothing to do with it. Nita, you're so creaky today. So
my chair got old.
Oil it up. So maybe it needs regenerative medicine. So
Perfect.
Anyway, I touched the area in the adductor, and he yelped. And I said, is that where your pain is? And he goes, yeah, that's where it is. I play hockey, and there's a move I make, and he showed me, that stretches that adductor out. And I said, that's not your hip joint, my friend. That's just a tendinitis, okay? So we did inject that. We used platelets and stem cells there, and I'm waiting to see how he's doing, and hopefully he will heal up from that. I've done, I don't know how many hundreds of those, and I think pretty much with amazing success. I don't remember anyone not having success with that body part. So we have to be careful at doctors not to rely on images. We use them in an adjunct to our examination, but too many doctors use them only. If a doctor doesn't touch you and he operates on you, you are not getting a good deal there. There are cases when that's needed to be done, but most times it's the examination and the history, talking to the patient, that's going to help you figure out what is really going on. And in this case, this guy does not need a hip replacement. Thank goodness. He's a young guy, he plays hockey, and he's a wonderful guy, and I don't want him to have hip surgery because he doesn't need it. It's not going to do his adductor tendinitis a bit of good. He would have hip surgery and come out of it with the same pain he had before. So be careful.
Good point.
You know who taught me that?
Your grandfather?
Well, yeah, my grandfather did. He was a doctor born in the 1800s. And I'll say it like this. My mom forced me to spend my Sundays with him. I lived in Chicago. He lived in Chicago. I wanted to play baseball, but I had to hang with my grandfather doctor, who was a philosopher also. So I would get educated. And he taught me that, I'm just going to say this. I don't feel the same way he did, but I'm just going to say it. Don't take offense. He called surgeons butchers. And back in the day, there wasn't much in the way of imaging. And he healed people in other ways. You might say, well, that's placebo. Well, if you get better from a placebo, go for it. I think placebo is the best form of medicine if it works. And we have studies showing that 30 to 40% of people heal from placebo. How does that sound? Wouldn't you rather have a placebo than a surgery?
Well, absolutely.
And
all day long.
People go, I don't want placebo, I want the real thing. Well, I don't know. It doesn't necessarily make any sense to me. But the guy who really taught me was Norman Cousins, who was an author, a very well-known author, who was the ombudsman at UCLA Medical School. And he wasn't an MD. He was a prolific writer. I forget what magazine he was the editor of. Do you remember the New Yorker or something like that? You're
I'll
more
look it up.
Intellectual than I am. So anyway, Norman Cousins, when I got into medical school, I was about 40 years old. I was a lawyer, and I was his lawyer for some projects that he did. And one of them called Humorex, a corporation that sent carts around the hospital with videos of comedians and things like that to make people laugh, to help them heal by laughing. So when I got into medical school, I didn't know what to do. I had a thriving law practice, and I called him up and I said, Norman, I got to talk to you. He was right across the campus from my law office. So I ran over there. He said, come on over. I ran over there, and we sat for a few hours. And he was slamming his fist on his desk like my grandfather used to do. They both did the same thing. And he said, Mark, you listen to me. You're going to learn how to heal your patients from me. And I said, great. How do we do it? And he goes, you're going to listen to them. You're going to sit and listen to them. You're not going to make any money from this, but you'll heal your patients. And he gave me story after story after story of patients that he had seen that doctors at UCLA didn't know what to do with. They'd send them to him, and he would find out the real cause underlying the issue. So he said, this is the way you will heal people, but you've got to be patient and listen to them. So I've had some great teachers in my life. I'm very, very grateful. And before I move on, let's get to some callers, if we have any coming in. Give me a call, 866-870-5752. You can use an assumed name. You can pretend it's your friend or it's for your family, even if it's you. And let's talk about orthopedics, what hurts in your body, and what we can do to heal it without surgery. Now, Nita, because we're having a little lull, you're on the pin. You ready to be on the hot seat?
Oh boy, joke time.
Put on your joke hat. I know you'll get the answer to this one.
Okay.
What do you call a sleeping bull?
A sleeping bull is a sleeping bull.
No, Nita, that's not funny. It's a bulldozer.
Oh my God.
I love your lilting laughter, Nita.
That's hilarious.
Okay, one more for you.
Okay.
Why wouldn't the shrimp share his snack?
There wasn't enough.
Well, kind of. He was shellfish.
I love it.
Okay, I've got to do one more because it's worth it to hear you laugh. Why wouldn't the poppy seed leave the casino?
It was stuck on a muffin?
Oh my God, Nita, that's so good. He was on a roll.
I tried.
Okay, I got to do one more. You'll never get this one.
Okay.
What kind of music do mummies listen to?
Mummies listen to rock and roll.
Oh my God, you're so close. Rap music.
Oh my God. That is hilarious.
Well, we have time for another question here before the break.
Okay.
So let's see what we got going here. Scheduled for shoulder surgery, bone on bone. Boo. Torn rotator cuff. So my right shoulder is bone on bone and I have a rotator cuff tear. My doctor has tried cortisone shots, boo, which have worked temporarily. I'm soon to be scheduled for surgery, so I guess those cortisone shots really didn't work too good. And actually, if you read up cortisone, Google cortisone and see what it does to you, you're not going to want it. It actually dissolves away the tissue. It kills the cartilage. It dissolves away tendons and ligaments. Don't do it. I had one lady come in who was a tennis player, and she could barely lift her wrist because that extensor tendon where we have the lateral epicondyle or lateral epicondylitis with tennis elbow was eaten away from 16 cortisone shots over the years. So I don't do that. I use regenerative medicine with PRP, which is platelet-rich plasma or stem cells, are both mixed together to regrow the tissue when there's a sprain or a tear or something like that. So she goes on to say, I'm soon to be scheduled for surgery, which I would rather avoid. Good. I am interested in your work and like to know if I'm a candidate. Please get in touch with me. Yes, so let's go over a few things here. Let me see if she responded. Yeah. I wrote back to her, sent her some studies, and she wrote back to me again, said, thank you so much for responding. My range of motion is somewhat limited due to awful pain. I'm sorry, it's terrible. Sleep is difficult, so is dressing. It's really affected my quality of life. Now, I've been in her boat more than once. I've had both of my shoulders locked up with adhesive capsulitis, frozen shoulder. One was a skiing accident in Colorado when I fell going about 50 miles an hour, hitting a bump.
Ouch.
Yeah, I was out of control, no question about it. Landed on my chest, skied it hurt bad, by the way. My chest was really sore, but I skied the rest of the day. Drove home about an hour away in Denver, and actually I was at a run called Mary Jane. I will never forget it. And you know what Mary Jane stands for, right?
Marijuana.
Yep. I didn't know that at the time, and I wasn't smoking, but I caught an edge. There were bumps as big as moguls, as big as me. And I caught an edge and was sliding down the hill the wrong way and went up in the air and landed on my chest. By the time I drove home, my left arm was locked up. I could not move it. My right shoulder also got locked up after a failed surgery. Now, I mentioned what my grandfather called surgeons. I don't think that they are butchers. I think they do the hardest work in medicine. I love surgeons. I just don't think they should be doing all these rotator cuff surgeries, all the meniscal tears, all of these back and neck surgeries when we can heal most of it by just injections where a person walks in, gets injections, and walks out. It's a very, very non-invasive, conservative type of procedure doing regenerative medicine. I don't know why all the surgeons are not doing it. Well, maybe because it's not covered by insurance.
Oh, that's a minor detail, right?
Yep. So anyway, bone on bone, a misnomer. I rarely ever see a patient who comes in saying, I have bone on bone, who has bone on bone. Yeah, they've got some cartilage that's worn down, but that's not the big deal. The big deal is they have pain. So be careful. If someone labels you bone on bone, you probably don't have that. If it is bone on bone, you can't move. Oops.
Break time here on Living Pain Free with Dr. Marc Darrow. Grab a pen or a pencil, write down this important information coming your way. I'm your host, Nita Valens, and we'll be right back.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.